Hi everybody, my name is Dr. Anna Folckomer. I'm a licensed acupuncturist, board-certified herbalist, and clinical anatomist. And I'm excited to return to the annual Folckomer conference where we will speak about understanding the differentials of back pain. This is a topic that I feel very passionate about because if you haven't figured it out yet, we kind of need to know how to treat back pain. It's pretty important, and often the experience that I see when I'm mentoring other clinicians is that people don't always feel confident with that, and that's totally fine. But you should not walk away from your patient crossing your fingers and hoping that that treatment that you just gave work. There is a way to have a sense of exactly what you're doing on top of all our already very specific diagnostic methods, going through sort of our Eastern medicine diagnostic approaches and really understanding the body and the human experience from that lens. There's also an additional component of understanding it anatomically, and that's what I'm here to provide and help clarify. Clinical anatomy is a really great communication tool. It's a great way to communicate with your patient, and it's a great way to communicate with other providers on their healthcare team. So not only does your confidence boost, their confidence boosts, and they have a better idea of what to expect. So whether or not you're selling packages and saying, hey, I need 4 to 6 visits to really tackle this, or you just want to give them next steps of, hey, I think that an image would be appropriate, here's what I think you can expect to find on that image. These are all going to be things that are easier, they're easier to do than people would think. There's a couple of straightforward tests to really help someone understand what it is that's going on in the body. And so when you understand structurally what is creating this experience of pain and discomfort for the person, then we can add to that our own Eastern approach and really tackle this problem from 2 different angles. So from a Western perspective, you're getting a really nice blend, a yin-yang balance, if you will, of palliative care with preventative care. So treating it in the moment, but knowing what to expect, knowing what might be coming down the pipeline, and also understanding this person's experience. How did they get to where they are when they're walking into your office? What are the things that contributed to that? Understanding where someone came from is going to be pretty crucial into understanding where they might be headed for that. So join me this year for the annual Folckomer conference in Florida, and we will talk about how to better differentiate some of these back pain patterns, because not all back pain is the same. And yes, some of them can actually flare up if you don't treat them exactly in the most appropriate manner for them. So no fingers crossed at the end of your appointments. Walk out of there feeling like you really know what you just did, and be able to communicate that to your patient so that they can also become better educated on what their experience is as well. The therapeutic effect of just the general understanding of what a person is going through is enormous. So in addition to all of your efforts to be able to treat this person, the added education element on top of that for both you, the clinician, and the patient are going to just take your treatment that extra mile. This is something that I see on a daily basis in my office. I have had the privilege of working with people on an international level, and the success rate for this is really quite high. I'm not going to assign a specific number to that, but I think that, the anatomy is the anatomy. I didn't make up the anatomy. The anatomy just sort of is what it is, and it's our job to understand that and communicate that with our patients so that they can see that, whether it's, looking at trusted sources, opening an atlas, showing why your acupuncture meridians work the way that they do, and helping translate that. Remember, we have access to a very special language that not everyone else is going to understand, and it's our job to help communicate that, because some of the things just get lost in translation. So I hope to see you this summer. Again, my name is Dr. Anna Folckomer, and I'm looking forward to speaking to you more about back pain.